suffer for work, enjoy for heaven. This thing they happen to anyone. I come from nothing, head by many things, but this thing they happen to anyone. Yeah. I live the life that I love. I love the life that I live. Tomorrow is not promised, but I'll keep the things that I need. Love is in the air, where face smiles. No matter me, matter, I'll be rich till I die. 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 If plan is plan A, better plan is plan B. No pain, no gain, no face, no case. Look good, look good. I live the life that I love. I love the life that I live. Tomorrow's not promised, but I'll keep the things that I need. Love is in the air, where face smiles. No matter the matter, I'll be rich till I die.
All right, Alice, you can get the ball rolling. You muted.
Yeah, I know. Okay. Well, hi everyone. Welcome again to Healthcare and You. Today we're having a great show. First of all, I would first like to apologize for coming on. We came a little late because of some technical difficulties. But my name is Howard Alice Coon. Most people know me as Alice Coon. I am a co-host for Healthcare and You, and also the owner of Unique Health School and Caring Hands of America, a home health agency. Today we have a great topic to discuss. Substance abuse. I think we all can relate one way or the other. But before we can get started, I'm going to give everyone the opportunity to introduce themselves before I can tell you a little bit about our guests and also give her the chance to introduce herself.
Okay. Right. Hi, everybody. This is Julia Parker Seville, co-host of Healthcare and You. It's a pleasure to be back again on this Monday. I'm the program coordinator at Unique Health School, and I am thrilled to be here to hear today's topic on substance abuse.
So I'm Alvin D. McKay Sr., and I'm the host. And so thank you to our guest for today.
Our guest today, Miss Maddie Snow. I hope I'm calling her name right. I'm not making a mistake here, because not only is she, of a family, but she's also, a great buddy of mine. She have really inspired me. I know when I came to this country first, like I just gave you that brief history, Maddie, all in the healthcare business, it was very inspiring. So today with her expertise, I think we can really learn a lot. So I'm going to give Maddie the chance to tell us a little bit about herself, her background, and then we can just roll into it.
Hello, everybody. And sorry for the lateness. It was my fault. Yes, like how I said, she my mate. So it's been a long journey in America, going through nursing school and becoming a nurse, learning, doing business, healthcare, and having to participate in the substance abuse program in Maryland. I service one of the biggest facility in Maryland that deals with substance abuse and post-traumatic stress disorder. I'm actually the director of nursing, and I've been a director of nursing there for over a year now. Before I started working at mental health, it has always been my specialty. So yeah, I am honored to be a part of the show today. Thank you for having me again.
Thank you so much. Thank you so much, Maddie, for being here. And we are very pleased that we got somebody that can talk or speak directly to this topic, especially knowing that this is your day-to-day activity. This is something that you deal with on a daily basis. Some people, like when it comes to nurture, a lot of people are afraid to do anything mental health. So what we just want you to elaborate, because I know Michael will be coming in with a lot of questions. He loves to ask questions, which is a good thing. But before we go into it, I want you to just tell us a little bit when it comes to substance abuse. What are some of the things that you experience on a daily basis?
Well, I hope all the nursing students out there have the opportunity to listen to me, because this is one part of nursing that I really, 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 really had to pay a lot of attention to be able to be as successful in it. So, substance abuse comes with a lot of packages. One of them being post traumatic stress disorder, or PTSD. PTSD is one of the biggest reasons why most of the young folks out there go about seeking drugs for comfort. Sometimes it's their upbringing, sometimes it's their lifestyle. And let me piggyback to us as Liberians. We grew up in a country that had war for several years. We do not know that post traumatic stress disorder has a big part and impact on our daily lives. What is post traumatic stress disorder? Post traumatic stress disorder is a residual after a traumatic situation that interferes with a person's physical and mental coping strategy. The way you respond to situations, the way you accept situations, the way you handle it. Personally, and I was telling how I this the other day, I think I have PTSD. I think most Liberians have PTSD because of the way we grew up and the trauma we went through. So growing up, drugs and cocaine and marijuana was not very popular. But as you all know, after the war, it became so common. Like it was like, all right, everybody now knew what marijuana and cocaine and heroin, everything was, because people ran into that direction for comfort, for the feeling it gave them of not paying attention or not being normal. So substance abuse can come out from a lot of other reasons. It's a lifestyle, it's an addiction. We all know it, we get it, but it's triggered by something. So in Africa and the Western world, we do not have the education and the knowledge that these folks have here in America. The psychosocial therapy, the methadone therapy, the addiction clinics, and the Suboxone, the medications that are used to treat these things. Nobody talk about it in Africa because everybody has their own side of the story. Nobody is there to listen to anyone. Oh, you're making excuses. You don't want to go to school. You're making excuses all the time and consistently shutting people off instead of just hearing them out. Sometimes leading to the frustration of seeking their happiness and their comfort in a different way. And these are all the things that triggers the whole substance abuse and addiction. And whether we want to accept it or not, it is the reality. Oh, she lazy. Look at her. She just want to lay around. She don't want to work. He lazy. But maybe he has something deeper going on inside that no one is hearing him or her out. No one is taking the time to listen. No one is giving him or her that psychosocial therapy without being judgmental to the person's situation. So that trauma is always there.
Right.
The trauma is always there, and people don't want to deal with it. People have different coping strategies, and
Right.
because they want to deal with it, they go about their life with drugs and get in their own direction, which is where the big part of our problem is. Then we have the overdose. So I'll take some questions, and then we can dive into the treatment and how we
Right.
help these folks.
Right. What's Judith? So thank you so much. Like I mean, just to go just to add up to what Miss Madia was saying, and then Judith, you can chime in also. So when and to break it down or bring it to the layman term, when you some people go or start using like they call it here, or having substance abuse because they're running from something. Now, everybody are running from different things. It could be depression. And sometimes you feel that when you drink, you ready running away from the reality of facing your actual fear. Like she talked about PTSD, you know, it's not only because of PTSD that people struggle because substance abuse. Sometimes we have children that have personality disorder, and because of that, they're very impulsive, and they are followers. Sometimes too, just the mere fact that you know most of our kids wants to feel that they belong, they want to feel accepted, especially in the high school. I've talked to many kids that will say, oh, all the cool kids, that's what they will say. All the cool kids were doing
Yep.
it, so I wanted to do it too. So peer
Mm-hmm.
pressure, when it comes to the high school year in America, peer pressure is one of the biggie when it comes to substance abuse, because my friend is doing it, and he's cool, and everybody kind of look up to him. I feel I want to be cool too, so I'm going to do it. So we need to be able to look up for signs, and in our kids, and even in grown-ups, because it's very difficult for people to accept that, oh yes, I am I'm an abuser. It's not only medication. You could be abusing alcohol also. So I don't want you guys to, you that out there that listen to when it says substance abuse, it's just limited to medication or drugs, or but it's also, it could be alcohol. If you get up in the morning and the first thing you want to do is drink alcohol, that means you addicted to that. So now you see it's leading into addiction. So there are different components when it comes to substance abuse. Julia, you want to chime in?
Yeah, you touched on what I was going to speak about, that it's very important. I think a lot of people hear substance abuse and they automatically think cocaine, marijuana, heroin. But substance abuse, it pretty much can be anything that you're consuming, not the recommended amount. So for example, I've mentioned it a lot of times to my students, ibuprofen, Tylenol, those are things that are over the counter that's available for everyone to purchase, and people are becoming addicted to it. It's still considered a substance abuse. So it's very important to look at some of these signs and symptoms. So a lot of our viewers may be asking, what are some signs and symptoms to look at? Is your family member withdrawing? Are they sleeping more or less than usual? Is there any change in their personality? So those are some signs for us to start looking at.
Yeah, and just one thing, I talked to a kid a week ago, and because his mom is Liberian, and she said to me, I don't know why he's doing what he's doing, and she was thinking about sending him back home. So I had a one-on-one with him, just mere conversation, not medical or anything. And he told me, one way or the other, I wanted to get my mom attention. She said, I tried so many times to express myself to her, to tell her things that were not going on in my life the way I didn't expect it to go on, but she wasn't listening to me. She thought that things I could handle, and because I needed to get her attention, so I started smoking. Can you imagine that? That because of rebellious, he got into
Mm.
smoking. He just wanted his mom attention because he felt when he's doing that. And now the kid is like way past, I don't want to say, because I don't think any kid or any person is beyond redemption, but it's like it take a lot now for us to bring him back now, because he need more rehabilitation now. So there are things that we parents will have to pay attention to, to see what, some of the warning signs. So to go back to you, Maddie, what are some of the warning signs you see in your patients?
First of all, before I go to the warning sign, it is always good to listen to them. That is a big part of their recovery. Listening to them and being empathetical with them, sharing their feelings, and sometimes that's all they need. Somebody to listen to them and put themselves in their position. You'll be surprised the difference it can just make just to sit there and listen to somebody's problem and
So
empathize.
what will you do? I mean, looking at the other side of the coin, what will you do if you have a child who's an introvert or who's not willing to really sit and talk, but um at home he or she, I mean, you all you know about that child is that when he or she is home, they're in a room and they're doing a book and stuff like that. But when they're outside, they're a whole new character. But when they come home, I mean, you ask questions. It's the normal routine. Oh, everything was fine. But at the end of the day, when they get out there, they showcase a whole new character. How do you relate to that kind of character? How can you know if there's any warning sign, the red flag? How do you notify that?
First of all, as a mother, before I even became a nurse, I know my child's personality at home. Like you said, at home is different from school. And that is
Mhm.
why I stay in touch with the teacher. And I stay in touch in every aspect of her school life to know what's going on. So if there is a difference in her behavior at school,
Mm-hmm.
I may not pick up 100% of it, but I will be picking up some of it because I stay in touch with the teacher who will tell me what her routine is and how she's complying with her time in the classroom or how she's being non-compliant. So that would give me a FYI. It'll tell me, okay, something is changing and something is not changing. So as parents, first of all, I encourage you to be 100% involved with every last part of your kid because that's the only way as parents you can pick up those things.
Yeah,
Because if
another
you
thing.
only know
Oh,
their
sorry, go
child
ahead.
from home and you don't know them from school, then it's going to be hard because like you said, when a child is home, he or she
Mm-hmm.
stays in, he or she doesn't talk to you. Are you okay? Everything is good. Did you do your homework? Yeah. But if you're part of the homework and if you're part of everything, you will be able to pick up something there. Okay, that'll give you a sign. And then if you knows it like me, that kind of parent who knows it like me, I'm quickly emailing the teacher to say, what is about this? Like for the past 2 days, I have not received homework. I've not seen any homework from you. Why doesn't my child? And then my daughter, don't you trust me? No, baby, I really trust you. I do, but I also still, as a parent, need to speak with your teacher to know why is she not giving you homework. So I don't
And
make that.
I'm sorry, but so I mean, looking at our environment here in the United States, and I believe in Europe and other uh, modern countries, right, where a lot of rights are given to teenagers, high school folk, children, more especially when they pass that ninth grade, going up to 12th grade and stuff for what secondary. Or how do you guys call it here? It's the
I
same
think,
high school, right? But
yeah,
they
high
got so
school,
many names and so many.
high
Yeah,
school,
so
high
high
school.
school. So I know. But my daughter told me that she's going to pass to the fifth
11th grade.
grade,
Okay.
fifth grade, and she said she's going to she got a name for it, and I told her, I said, but in Africa when you say you're going to um how you call it, I think from sixth grade we start calling it what
We
Middle
got
middle
school.
school. I
junior
think
high.
middle school, right?
School.
Yeah, she
Middle
said
school.
Yeah.
yeah, I'm going to middle school. So I was confused. Fifth grade telling me going to middle school.
Middle
I know
school,
middle
right?
school is after sixth grade, right? But on
Right.
this side they say fifth grade. So they got a
Mhm.
whole lot of
Yeah.
confusion stuff. So the question is, and I mean just to help parents out there who are struggling with these kind of things, because there are some children, like I said, they got different characters that you have to battle with. When they
Yeah.
come
My
home, they
my
show
kid.
you one character. When they go out, they got one character. Just a second. So the thing is, and they got rights. When they come home, they need privacy, and they will tell you upfront, "I need privacy." How do you, as a parent, navigate through the whole privacy thing? I need to give my child chance to do this and do that, and at the end of the day, while you're giving them chance, they're taking chances and doing their own stuff. How can we, as parents, navigate through all of these things to know when there are red flags?
It's a give and take, my game. I have a high school student right now, and I have a graduate in a college student. So for me, because every child, you can have 3 children as a parent, and all of them have a unique personality. I promise you, they all coming with their own thing. Some of them could be, how they spoke on. Other one can keep everything in. But the one thing you have to do, I normally, if you have a child that you're monitoring and you're going along with, if you involve in their life from the beginning, and you have that open communication system with them, once something change, first of all, if they start doing substance abuse or they start abusing something, their grades drop. That's one of the warning signs that I've heard from most parents. Oh, he was so good in school. He was doing well in school. There was no complaint. Now we hearing complaint from the school that he's probably sleeping in class, or he probably not turning in assignments, or maybe hey, he was a B student now, he dropped to a C student. Those are
Maybe
all warning.
staying too long in the restroom.
Exactly. He's saying those are all warning signs. I'm telling you, especially their grades. Because think about it. If you're abusing, you feeling sleepy, you probably not turning in assignment, your grades definitely going to drop. That's one of the way that you keep in touch. Another way that people try and or they don't pay attention to. My kids, if they bring their friends around, I notice how they interact with them. You see that they are more vocal, the more they interact well with them. So I try to observe that. So if you home with me and you playing the whole shot thing, and meanwhile when I'm observing you out there, you're a whole different person. That's a problem. If I take my son, my 12 years old, that's the youngest I have now, 12 years old, when he having function to the school and we take him, he think I'm just sitting there waiting for him to finish doing his thing, and I'm listening to all their conversation. They normally say, "Oh, mommy got 3 years." I normally listen to all their conversation. By the time we get in the camera, so why was he saying this one? Why the person saying this one? He can't believe that I was actually listening into them. So then you kind of catch up on who they're talking to, the kind of people they're around, and how they interact with them. So those are some of the things that parents need to watch out for. And I know, like you said, privacy in America is a big thing, but you have to be a parent first. I'm going to give you privacy to an extent if you show me that you are responsible. If you are not responsible, the privileges will be taken away. Now I'm going to take your phone. Before my son hit 11th grade, even though you were in 10th grade, everybody used to think that we were being mean. On Friday, we give you the phone. You have the phone all through the weekend. On Sunday evening, we take the phone from you. You don't get the phone any weekday for school. No, because you didn't show us that, you're ready to take responsibility of that. So the whole week, no phone. Like I told you last week, since I came in this country, and that is not fitting with everybody. My kids never go out to the school bus. I drive them to school and I pick them up. It was just me, my own extra protection. And I would be like sniffing when you come in our car to see whether I smell anything I'm not supposed to be smelling.
That's the part I can get, what is sniffing.
Sniffing. Making sure, because you'll be surprised how things turn quickly if you put all your effort to bring up a child, and then because you're not listening to them, like Madi said, you're not having that communication with them, you're not making them free to say, okay, you can come to me first. You're the first to judge them. You're not trying to open your mind to see, let me see where my child is. They're going to talk to somebody different quickly, and everybody have an opinion. Yeah. So that's how I feel you can watch out for that.
And I mean, I don't have kids yet, but from my experience as a pediatric nurse, a lot of things that we saw coming into the hospital with the substance abuse is the parents didn't know, but the friends knew about it. So I think as parents, it's very important to know the company that our kids are keeping.
Right.
We have a good relationship with our with our kids. The moment they are withdrawn from us, we know something is up, whether it's them taking a substance, they've had a fight with a friend, they've had a fight at school. We'll be able to catch up on clues. But a lot of things that we saw were oh, I didn't tell my parents. I'm telling you this now. Are you going to snitch and tell my parents? So it's like we have to find different means of trying to pull the information out of these kids.
So I have a question for I mean, Maria probably will be able to speak to them more. So we see that sometimes people come into the facility, maybe they're not really addicted to anything, but because of the pain medication, they get addicted to that pain medication. What can we do to minimize that? Because that will be coming from a healthcare, point of view. Like that person came in, okay, they were just having some pain, and now they're addicted to that pain medication. What can we do to prevent some of those things from happening, especially medications that we know that are highly addicted to?
This is why we count narcotics in the healthcare setting, because of the addiction reasons.
Mm-hmm.
It's very easy addicted to. So, and not only narcotic and pain medication, but there are a lot of other medication like anti-anxiety. Those are all addictive. So we all know as nurses there are class 1, class 2, schedule 1, schedule 2 medications. Though all of those medications are considered controlled drugs, some of them, which are narcotics, are addicted to, because what it does, it also suppresses your central nervous system, making you very sleepy and drowsy, and not with it, giving you the same similar feelings as heroin or cocaine would do, similar, while taking your pain away. That is the reason why people like it. And pain is supposed to be subjective in America, not objective. So if a person who, example, is supposed to be on oxycodone every 4 hours, PRN as needed, is coming for that PRN every 4 hours, even though you see him or her jumping up and down and walking and looking, smiling, and does not show you any cue that he or she is in pain, but he or she just want her medicine because it makes them feel that way. That's what it is. That's why the DEA and the practitioners out there have to be very careful about how they regulate the pain medication, especially for people who are taking it frequently. Now, somebody who had surgery, hip surgery or hip replacement surgery, we already know that person is going to be in pain. For somebody who had a spinal cord surgery, that person is already going to be in pain. But here's what I do as a director of nursing. First of all, to keep my facilities safe from state surveyors and medication diversions and all these kind of things. If a patient come in on morphine, dilaudid, at the same time, so looking at this patient medical diagnosis, do we really need the morphine?
Yeah.
We change the morphine from a long-acting morphine, or can we change the dilaudid to a gabapentin? If it's just nerve pain, can we go for Lyrica? Can we consider reducing the scheduled medication and the classes of medication that will cause the addiction?
Okay, thank you so much. That was good. So just to add up to what Amadi was saying, Mikey, if you have any questions, you can come in. So substance abuse have different effects. It could be long-term effect, or it can be short-term effect, depending on the kind of medication that you're taking, right? Now, the reason I say that, because we have medication coming in different forms. There are people that get addicted to our oral medication. There are people that doing intravenous medication, that's putting it straight up in the vein, which is an immediate effect. So some of those medications have a high effect on your heart. Not only on your heart, for those that are taking the pills, we have GI issue. That's why you see most of them, they have ulcer. They have severe ulcer, and that's like bleeding in the stomach. So it have different kind of effect on you depending on the kind of medication that you are abusing. I have a friend in Fairfax that I'm not going to say that name because she just lost her son 4 months ago to drug substance abuse, and he took something in his vein. I don't know what it is. I don't know. People are saying something that started with the word P, and that was his first time, and he, injected it in. Now he started having seizure, and then went into coma. When he came out, he was paralyzed from the waist down for some reason. They had him in the mental facility talking out of his head for so long. She was not trying to give up on her child. She was visiting him. She was scared, but obviously he did not recover. And of course, she lost it because he was dead in the brain. So depending on what the kids are taking and the amount they are taking, it might be reversible, it might not be reversible. And that's why I always, every time I have the opportunity, because I got 2 boys, I let them know that there are some mistakes that you're just not going to recover from. There are some mistakes. So every time I encounter a story like this, I make sure when we are in a big gathering, I'm going to start talking about it so that you're listening and you know exactly what is going on, because there are things that they will be addicted to, that sometimes coming back from those things are very difficult. So depending on what you are taking, may affect you differently, may affect your heart, may affect your mental status. It's just bad for us, period, or for the kids.
So I'm sorry.
Okay, yeah, go ahead.
Most of the folks who are discharged from the hospital and coming into a long-term care setting, or even going home from the hospital on a controlled drug, here is what is instructed to them. You need Narcan. Narcan is an opioid antagonist. Now they make it so easier where you can just spray it in the nose. You don't even have to juke or anything. If you feel yourself being too drowsy and not with it, take a Narcan. The war is so out there, and I am actually one of the advocates for Narcan. There is nothing wrong with utilizing Narcan if you're on those strong pain medication. Believe it or not, even gabapentin, that is supposed to be a neuropathic pain thing, can also be addictive.
It's actually in the hospital, gabapentin is now a controlled substance, so you have to have a witness.
Right. It's controlled down.
Yeah,
that's new. It wasn't like that back in the day.
Exactly. Yeah.
But now it is, because people are using it to dope on.
And when she mentioned Narcan, that's the antidote, pretty much.
So the antidote for overdosing, if you
okay, so it's like it neutralizes whatsoever overdose.
Right.
That is one of the easiest thing to keep in your house.
Yes.
Right.
To your primary care doctor, and you or your child is put on any kind of controlled drug, it's not going to be a shame or hurtful to say, can I have Narcan as needed?
Yes.
And keep it in your cabinets just like you're keeping any medication in your cabinet.
Actually, that's actually very a good point there.
Save a lot of lives just by that dose of.
That's great information.
Right. Yeah, that's
so
that's very good.
I was just, since we're talking about drugs and addiction, I just want, just for stats, and for our listening audience, I read an article from the United Nations Office on Drugs, and they gave a brief stats on those who are using injection and stuff. And just imagine you have globally here, they estimate like 11.2 million people worldwide that use injection on a daily basis.
Honestly, I think that number is more than that.
Yeah, more than that, right?
Yeah,
Right.
So
actually more than that.
and because of the 11 million, you have half of this having hepatitis C. You have 1.4 million living with HIV, and about 1.2 million living with both HIV and hepatitis C.
Right.
So that's a huge number for me. It's alarming. So
It is alarming.
If you guys are saying that it is more, then wow.
It should be more. And it's alarming. And then think about what we were talking about last week, Maggie. Think about and I'm gonna go back to Africa because at least they got some control when it comes here to America. But think about our people back home where we can find this medication on the street so easily. For people here, they can easily go and trade, play pin, or I hate I impede for people to administer it to them because they can't just find it over the counter that easily. But think about Africa where you can just go to any drugstore and buy a Percocet or buy, and get needle and do all of those things. So with the medical system being so poorly regulated in Liberia, think about how many people down there that are dying that we really don't know that either dying from hepatitis C or B, because that's through the blood, or maybe HIV, and only because they're using, not because they're having any kind of peculiar behavior, but because they're using, injections, they're sharing needles and injecting themselves.
So for the sake of our audience, I'm sorry, for the sake of our audience, can you please just tell us about the difference between hepatitis A and C and the other one you talk about, just so they get to know. So there is somebody out there that borrowing from it and don't even know.
Yes, Julia will jump me when she read. So hepatitis A, right? Hepatitis A is actually transmitted. They normally would say fecal oral, right? So for instance, people that are taking care of food, it made it through the through our mouth.
Contaminated.
Right. You go in the bathroom and you don't wash your hands and you touch touch your food, somebody eat it, and of course they're going to get hepatitis A, right? So hepatitis B, the B, I normally tell my students think B and think blood. It's transmitted through your blood. So you can't get it except you got blood from somebody, or maybe you and somebody using the same needle, same as C. So B and C is through needle or blood, and the majority of the rest of them is through contaminated water or contaminated food.
And when you get a word HIPAA, think liver.
Right. Right.
That had to do with HIPAA, think liver. So that all of hepatitis A, B, C, or
all of them,
the liver affected right there. It's
right.
Liver.
And when your liver is affected, that's a huge thing, because the liver controls so many things in your body. And then again, this is just a huge topic that is just going to go from one thing to another. It's a huge thing, because when you start having liver function or disorder, you're thinking a lot, because now that a whole lot of other things are going to be affected when it comes to that.
Encephalopathy. Then you get those liver encephalopathy, which also
jaundice, all of that.
Jaundice, yes.
Yeah.
So is it possible that some of these drugs that are even prescribed by some of these doctors, because there's theory or conspiracy theory out there that like I asked the same question the last time, that some of these doctors they do businesses with pharmaceuticals companies and stuff like that, and it's a whole network. And so sometimes there are some prescriptions that are given to certain patients, that not necessarily they should be taken, but then they prescribe them anyways because they get their kickback or stuff like that. So if that should be the case, as a patient, what will you do? Can you suggest to your doctor that it's not working? This is not right for me. I'm feeling this way, that way. What can you do to avoid, like you said, because if I'm taking certain medication, it's messing my liver up or messing part of my organs, certain organ in my system up, what do I do?
So go ahead. You sound like my patients.
I was gonna say every medication has a side
effect.
One, and two, a lot of these patients that are getting prescribed opioids or high risk medication, it's a type of high that they feel, so it makes them feel good, and they're not gonna want to report that, hey, this is making me feel a little good, a little loopsy, a little sleepy. In fact, we'll start sharing it with family members, right? We'll start, you know what? I had trouble sleeping last night. I took this Oxy and knocked me out. Here's a pill. So it's very important to bring awareness to the different effects that these medications can have, so that they can know, okay, we understand it's giving you this effect, but also here's the consequences of overusing it.
So I like the word that Miss Juliet used right now. She said sharing. She used the word sharing. And I want to
Share.
elaborate on that a little bit, especially when it comes into an African setting, right? You can go and have you having let's say infection, they gave you amoxicillin and you take it, right? And then after 2 days, you feeling better. Somebody else feeling sick. You say, "Oh, I have my balance medication." Yeah, you can do it. They do the exact same thing when it comes to narcotic. You will be surprised how many person whom you go into. Oh, I have some morphine, or I have some this here that I was taking last week. You don't know what side effect it's going to have on that person. Yep. Now you go to that person, and maybe they start hallucinating. Because some pain medication will cause you to hallucinate. And to break it down for other people, hallucinate means you imagining things or seeing things that are not there, right? But that's the side effect it's going to, because the side effect that the medication is having on you, having, maybe completely different from what it's having on me, right? So please, African parents, sister, stop sharing your drugs. If you go to the hospital, if it's given to you, that means it is for you. That means your doctor have ran many different tests to say that this drug can work with you. Now, it's not for everybody. So that word sharing really grabbed me because I don't want to say
we the African be sharing our drugs.
Right.
That's not.
Yeah. and yes, and another thing too, you see, especially in the older population, they have drugs. They have you go to the home, they have a drug container, and they have yellow pills, blue pill, red pills, all in the same container. That it. And eventually they're going to forget which one is the yellow pill. Just maybe they went to Marty's house and Marty like, oh my God, I this medication my doctor gave me really work for my migraine. He said, please give me 2. Now I put that 2 in that box. And now I come to Juliet's place and something else she's taking for GI. Please give me, and then I put it in that same thing. Eventually, what are you really taking? Some of these medication interact with each other. What are you really taking? Please stop sharing your medication. It's for you and you alone.
So I have another question. Can addiction be prevented or can it be cured? Can it be cured or prevented?
It can be prevented. One of the way of preventing it is minimize the that makes you addicted to it.
Right.
If it's drinking, then nobody said don't drink, but minimize it.
Right.
If it's heroin, paper, go for your methadone. See talk to your doctor about getting into a recovery program. There are 2 kinds of programs that are offered out there. There's a Suboxone. It's like a Suboxone film you put on your tongue, and it dissolves. It takes the craving away. It's an antagonist that antagonize the craving. So that craving for heroin, cocaine, is going to go away. Or your methadone pill liquid is also for pain. These Suboxone and methadone are also drugs that are used for pain. So it's doing 2 things for them. It's taking care of their pain that they have, and it's also taking care of the substance abuse.
The craving, okay.
Yes. So those 2 drugs are the most popular and most usable kind. And I'm not sure if it's in Liberia. Maybe we're gonna get rich one day. Me and my mate, we're gonna go open our methadone clinic.
You never know.
You make a lot of money, not only in Liberia. I think you have marketing Sierra as well.
Right. No, it's true.
It is what it is. Not to say when they're on, they still don't do what they're supposed to do, but it gives them a lot more longer life.
Right.
Because so if they were supposed to get 1 needle of heroin today and it dope them out with the methadone being in the system, they might need to use a couple of needles before they can feel that dope. So the methadone or the Suboxone, you can't be on both at the same time. It's either or. The consistency of taking it and monitoring. Unfortunately, sometimes you have to monitor that they're taking it because they want to they want to still do their drugs. So a lot of times they know this medication will counteract the effect of the drug. So a lot of them will not take it, will refuse it, but encouragement and continual motivation, it really helps them. It's
Yeah.
expand their life.
And another thing too that's hurting people too. So we need awareness. Some of them, you go to the facility and they give you pain medication, and they should be giving you information sheet that you are supposed to be reading and know what the drugs interact with. There are some medication or some pain medication, whilst you on it, you cannot be drinking alcohol. It have a serious side effect. But most of our people really don't realize it because, I always like to say we, because I include myself in it. We don't like to read. They just take that medication. They give you that drug information sheet. We don't read it. So we take the medication, we start feeling better, and we hanging out with our friends and we're drinking alcohol. Now that is damaging something else. So maybe not even the medication causing the problem, it's because you're putting alcohol on top of that medication. So it's very important to know what medication you're taking, the interaction to other medication, because you can be taking certain medication like, oh, yeah, I also got headache. Let me take aspirin also. Those two medications going to be doing the same thing. And now are you going to be overdosing yourself? You can't be taking that medication, be drinking alcohol. You don't know the side effects of that medication. It's a, you shouldn't drink when you're taking those medications. So those are the kind of things, less information. So I think the more we bring those things, so especially for back home, since people already not reading, I think our nurses and our prescriber need to do more teaching, patient teaching. You're giving the medication, please teach about the medication. Let the person know that this medication is going to, you overdose on it, it's going to damage this, this organ, or it's going to be bad for you. You can't drink with it. Patient teaching. You need to teach the patient. My dad had a high blood pressure 3 weeks ago. It was like really hard. Okay, first of all, he went for something completely different. And then when he got there, they say his blood pressure was almost in the 200, so they actually wanted to keep him there. But then he said, oh, no, he want to go home. And the next thing, my sister called me and said, oh, we home. I'm like, why are you home? She said, because, they decided to let him go because, he said he wanted to come home, so they let him go. I said, did they tell him why it was important for him to be in the hospital for them to monitor? He said, no. So I was mad about that because he could go home and just die from stroke or heart attack. You know what I mean? If your person's blood pressure is that high and they're in a facility, a medical facility, and because they say they want to go home and you don't explain the reason why they need to be there, because I believe if you were taking your time as a medical personnel to explain the need for them to stay, they will stay. And if they don't stay, then that means they're going against medical advice, and let them have that documentation signed. We don't have that in America. Yeah, we have a paperwork. If I go in the hospital, I want to leave, they make me sign a paper against medical advice. There's an AMA form for me to sign to say I've been given all the facts and I'm signing that I still want to leave. Now, if something happened to me, I can't go back and sue that facility, right? Can we do that in our place to help our people? Instead of just throwing stuff to them, making them to go buy their own drugs, not explaining what the use of that drug is, and that's it.
And not every time a person say, I'm in pain, they should be given
medication.
Yep.
Right.
or non-pharmacologic treatment. It depends on the skill, on the pain skill, what the person can tolerate without taking a medication, and what they cannot tolerate.
Yep.
Some people just by resting, the pain goes away. Some people just by doing a little bit of exercise, movement. For me, I know when I have a headache, sometimes if I just take a shower and relax, or sometimes I'm hungry.
I just need to have a bowel movement for me.
Uh,
That's why I know I have headache.
yeah,
I'm like,
so-
well, when the last time I pooped?
Yeah, because you have to remember the liver metabolizes medication. And if you overwhelm the liver, mind you, that same liver is metabolizing your diabetes medicine, your insulin, your hypertensive medication, your hypercholesterol medication. So if your liver is metabolizing all of those medications, and then you're still adding to it, the more you give it, the harder it has to work. So the more you can minimize how much you give it,
The
the
better.
better you
You better be.
as a person. The alcohol content is also affecting it. So people who have diabetes, please stay away from the aspirin and the ibuprofen
And the alcohol.
and the alcohol. Please stay away from
Hmm.
the NSAIDs, anything that has NSAIDs in it. If you know you have kidney issues, stay away from the NSAIDs. People who have hyperlipidemia, which means you have high cholesterol,
Can you just break the terminology down a little bit so
yeah,
that
Cholesterol.
our
Cholesterol.
audience
high cholesterol, people
High
who have
cholesterol, high blood pressure.
high
uh-huh.
cholesterol, or any kind of cardiovascular disease,
Heart
hypertension,
problems.
Any heart
Wow.
problem.
any heart problems, and you're
Yeah.
taking any one of those statins, any of those drugs that ends with statin,
Mm-hmm.
STAIN,
Hmm.
please alcohol. The combination of alcohol and the statins on your liver can be very fatal. Please stay away from it.
All right. I'm seeing some comments here from Destine. She's one of our followers here. Uh, Let me just read some. So she says, "Yeah, I'm learning a lot. Yeah," and she says, "Let me put them up." First one, she says, I'm learning a lot," and then
She said, "Why? I see why the doctor gave them to
Why
us."
did this give- yeah.
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 So I
Well,
think she when she's talking about, yeah, when the concerning the medication that they prescribe, and they know that they have so many side effects, and why do they prescribe them? Why do they give them to patients? And they know that the side effect is more than what they're going to treat. I think that's the question she's trying to ask.
well, I guess if the
So
benefit
sometimes,
outweigh the weight and the risk, it's almost like cancer drugs. You know that you're going to take that cancer medication, but you know you're going to be weak. It's going to affect other things. But hey, if you're going to get cured from it, they're going to give it to you.
And as
Like,
So
Medea said, like they have the different classes, that they select
mhm,
from.
right. So
hmm,
it's,
it's like this.
yeah,
If I give this medication, it's going to affect her stomach, but she's going to get better soon. If I don't give the medication, she probably will die faster than. So we give the
mhm.
medication, let her deal with that stomach
So
pain. It's like that.
guys, I was
so
I was,
so
I was
so so so
Just a
go
limit,
ahead, go
just to
ahead.
put it in the
I
point for
was
people
put
to
in
understand.
such a rough, such just last week, I believe Thursday, I was put in such a rough situation where I have a patient who has CHF and the patient is on dialysis and that patient was dehydrated. How going to treat a person who has CHF, the person is diabetic and dehydrated
Hmm.
because the BN is skyrocket high after his dialysis. So that means he's dry. He needs some fluid. But how are you gonna give him how are you going to treat? Because the you gave him normal saline is going to overload him. CHF is gonna be triggered. You gave him fluid, he's gonna retain, he's not getting his dialysis for every other day, but yet he's dry. So
Right.
sometimes you just have to weigh your option.
The way, yeah.
In a situation, you have to see it is both of them are are hard because both of them are going to affect him in some way, whether it was a lactate or normal saline or even a D5. It will affect me, but you just have to choose
So it's like
the
trying
the
to
least of
solve one and getting prepared for the next one.
exact. Yeah,
Yeah, but the
Oh
next
my
one may not
God.
be as bad as the one that you're solving now. So that's how they weigh it.
yeah,
So the one that you're going to be dealing with later on, it's like ibuprofen, like we say, you take it too much, it's going to give you, stomach ulcer, or you're going to cause you bleeding in the stomach if you're taking it over plus. But hey, at this point, I got a terrible headache. I'm probably going to take my ibuprofen. It's just, you know, or somebody that is on, aspirin. We know it's a blood thinner. It thins your blood. So, but I need it. It prevents a heart attack. So I'm going to take it. Because heart attack is worse than me bleeding, so depending on what kind of bleeding also. But again, the doctors that prescribing this medication the way the benefit. So if the benefit is what you're going to get from that medication is more and than the risk, they're going to give it to you.
So she says here, she says she Desi is on our back today. She said
Yeah.
this is bad because some of these drugs causes a lot of problems within our bodies. We get sick and not well.
Well, if you're supposed to be getting well, that's saying, but if you're not getting well, that's when you need to go back in and say the medication is not working for me. Rather,
working.
it's I'm the same way I was when I came in. That's the way I'm in right now. In fact, I've developed other symptoms. Most likely, they're going to change that medication. So there's a blood pressure medication that some of our ACE inhibitors that they take. Our client take, but most of the time it gives you that dry, annoying cough that the patient just cough, and sometimes it already bringing the blood pressure down. But if that patient normally come in and say, you know what, I'm getting constant headache, I'm not sleeping at night because I'm taking this medication, I'm coughing, they're going to change it to another form of medication now. Maybe that one taking a little slower time to bring your blood pressure down, but they rather go with that one because now this one is causing you to have insomnia, you probably getting stressed and all of that. So it depending on the risk. So if it's not working for you, you know your body.
You gotta let
anytime they give you medication and you know say I went in feeding this way, and after 2 weeks I'm still feeding this way, and now I'm feeding other symptoms, go back into your provider and let them change it, let them know how you're feeding. But remember too, some medication when you start, like for instance, most antidepressant, it don't just pick up right away.
Right.
It takes 3 weeks, 3 weeks or sometimes a little more before you start feeling good. In fact, some people will tell you when they start taking antidepressant, they actually get way more depressed in the beginning, in the initial stage. So it depends. So that's why it comes in the game back down to teaching, patient teaching. Let the patient know how the medication is going to treat them so that when they start taking it and they're experiencing these symptoms, they're not confused, because some people will stop taking it. Like most men will stop taking some blood pressure medication because it causes impotencies. Men, if I know say it's going to cost me my
I'm not going to play around now.
I'm not going to be taking it. So again, if you feel that you're on a medication and you're not ready for it the way you're supposed to be,
my pressure goes skyrocket. I ain't taking that.
But again, that's the truth. And I will tell you,
listen, I'd rather pass off doing it than not doing it at all.
That's what, most men will think the exact way you think. The moment they have the little sign that things not working the way it's supposed to be working, they're going to stop taking that medication.
Yep.
Automatically. So you need to teach the patient that you're going to experience this, but it's not permanent. It's temporary. So, can you, deal with this? But sometimes even the temporary things, we don't want to deal with it. So, it is what it is.
Sometimes
all right, just before we close, because we're going almost about that. Oh, you want to say something?
No, I was just trying to back how out up there. Sometimes it's a disease process. The ACE inhibitor, specifically lisinopril. Somebody who has diabetes, that's pretty much the safe blood pressure medicine to give them.
For them, yep.
Because their liver doesn't have too much power, and their body is not producing that insulin like it should. So lisinopril also helps with less damage on the kidney as compared to the other one. So sometimes it's the disease process. Sometimes the doctors, yes, we know sometimes the doctors in Africa and around the world doesn't really take their time to explain like they should, because a lot of people don't have the medical knowledge. But at the same time, it's also based on the disease process. The person status, how they can help, what they can give you to fix one thing without breaking something else.
Right.
So I just want to ask the last question before we close up, because we're almost about. And this is one of the drugs that most of the time that our young people, not even young people, but most of our addicts or those who are addicted to drugs and stuff, or abusers, or whatsoever name you want to give it, they start off with this opium or marijuana. So the question is, and most of the time when you try to talk to them while they're still in the initial, using process, when you talk to them, they always tell you that marijuana it helps them to free think, to relax, and they don't see anything wrong with it. Some of them tell you that it's a natural herb. So what would be, I mean, you guys as professionals, what would be your advice for somebody listening out there who's just getting into using marijuana and think that it's just something to make you relax from the initial stage and there's nothing wrong, it's a natural herb and there's nothing wrong with using it?
I always like to say too much of anything is not good, even if it's something that is good. So yes, marijuana is a natural herb. Yes, they have the medical marijuana, which helps, but you have to understand that there's the amount, right? There's a restriction for how much you can take. So I think it's very important knowing that too much of it is going to do way more damage than it is doing good.
So
It's
how
just
do you
no.
know when it's too much? Because I hear you say you just listed two kinds of marijuana, the medical and non-medical. So which one is better? Which one
Same
would you
thing,
advise
different
that somebody can use?
Let me help City out there a little bit. I think what she's really trying to convey, like it's like our people back home taking herbal medication. Most
Mhm.
of those
Mhm.
herbs that they are using, those are the same medication that people go and take and process and study the
But
body and know say you're supposed to take this much. But our people don't know they will boil a whole cup full and drink it,
yeah,
right? So it's the exact same process. I think we all know marijuana is a natural herb, but how much can your body handle? How much are you really supposed to take that is legal? So it
Does it have
it's
side
supposed to be
effect? The
it's supposed to be
marijuana.
prescribed, of course. It does. Like she said, everything have some kind of side effect and a mental effect too. So tell me, when you take marijuana, what does it do for you? I mean, I haven't taken this. So I wouldn't know
Hmm.
whether it treat people differently, whether you hyper or maybe it make you sleepy. I don't know. I've heard different things from different people. Some people say, "Oh, I take it. I'm very active. I can think fast on my feet." Right? And
Yeah,
then some people say,
some
"Well,
people say they eat a
I
lot.
take it and then I can't move."
Some people say they
It
sleep.
makes them hungry. It just
Hmm.
make them hungry. They want to eat, 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 eat. Other people say, look, for some reason it make that man feel that way. But if I take marijuana, I don't want to leave my house, I just sleep. So again, how much is enough? So are you taking the legal dose? Because it go back to our people. We're not saying though our people not supposed to take herbal medication or herbal medication is bad for them, but because we haven't studied to know the quantity, most of the
Hmm.
time it's what is actually harming us because we're taking it in too many. And then like Maddie said that the liver is the one that processing all of these things. And sometimes when it's too much, it kind of damages the liver. So eventually you're going to be, it's not going to be healthy for you either way. So don't, and another thing, don't take it because it make you feel that way. Take it for a reason. Why are you taking marijuana? Is it because you sick? Okay, that's understandable. But is it just because, okay, yes, because it make me want to eat like that. So I just want to take it because I want to eat, or I want to take it because it makes me feel good. Now you're taking it for the wrong reason.
Just for pleasure, I guess, because
So
back
you're not supposed to
home,
be taking it for that.
yep. Back home, I know they used to process marijuana in cayenne. You know the cayenne that we eat.
I never heard
Soup.
that.
Yeah, they started doing it in soup. I'm
I've
serious,
seen people
and
do
to
it in
sell
soup.
them.
Yes.
People used to
I've
buy them.
seen people do it in soup.
Yes, soup
Mhm.
and drinks and all kind of way they used to process this thing. And they're doing them here too, as I learned.
Yeah.
So
Anyway. Well, it's a
yeah.
gradual teaching process, and I think that, like you said, before we go, I don't know what anybody have any more question, but like you said, it's a continuous updating people and bringing awareness to these things and letting them know, what is helpful and what is not helpful. I think the message that we all trying to give is the amount that you're taking, or let it be prescribed for you. Take it for the right reason, not just because you want to take it. And for parents out there, monitor your children different ways, and look at different things, not just one aspect. Like we all kind of chip in here. That might say have an open communication with them. And Julia said, watch their grades, watch the kind of friends that are bringing in, who they're hanging out with, how they've changed. Is it for the right reason? Is it for the wrong reason? Listen to them. Everybody wants to be heard. It is very, very important for us to listen. Even if we think what it's saying, we always have a beautiful teaching moment if we can just sit there and listen and then come back with something, and not be too judgmental with our kids. I think that alone can help them open up to us first before they go out there to the world to give them all the kind of different advice that we don't want them to have. So I think we should be able to do that. And then before I turn it over to you, Maggie, I want to take this time to say a big thank you to Maggie. We had a very, very nice time here with you. I know you have a lot of insight. We definitely will be calling you back for some other topics.
Thank you.
We would love to have you come back with us. And it's beautiful having you on here with us. Just sharing the knowledge and bringing awareness. We have to continue. We are nurses. We cannot stop. We have to keep pushing until the message is spread. Thank you, guys.
Well, folks, you've heard from Hawa. She's the co-host, and she hosted the program tonight. They have been Healthcare and You, the usual platform where we discuss healthcare-related issues, bringing you information, awareness about healthcare, and so our host, our guest, we want to say a big thank you, Ms. Maria Snow. We want to say a big thank you. We enjoy your conversation and your education tonight. Very informative. And like how I said, we will get you back here by the grace of God. We hope that you will accept our invitation again. And to all of you, Juliet, Hawa, we say thank you for just being here with us, also hosting this program. We have had a wonderful and educative time together, and we look forward to being here on Friday, same time, 7 p.m., where we'll have a brand new topic and maybe perhaps a brand new studio guest. So have a wonderful rest of the week.
Four key things to remember. Four keys to take out of this conversation to everybody who's listening. If you are diabetic, stay away from ibuprofen and aspirin. Number two, if you have high cholesterol level, stay away from alcohol, especially when you take your cholesterol medication.
Right.
3, if you have a struggle with addiction, feel free to talk.
Yeah.
Speak out.
Speak up, yeah.
Seek help. There are a lot of help out there.
It is.
Seek help. Stay away from pain medication if you're not prescribed for it. And if you have it, get your antidote. I can.
Right.
Thank you so much. Thank you so much.
Yep.
So you
so much. It's
just
beautiful.
heard four beautiful pointers again. Please, if you are struggling with these issues, please take note and either calling it, or else you'll be damaging your own self and not knowing that you're doing it to yourself. So well, thank you again, and have a pleasant rest of the week, folks. See you again on Friday, same time.
Bye-bye.
Bye-bye.
Bye.
Suffer for work, enjoy for heaven. This thing they happen to any.